Pathways Speech Therapy is a private practice offering comprehensive services for adults with communication, cognitive and swallowing disorders, including consultation, diagnostic evaluations, and individualized treatment programs. Founded by Devin Chisholm, a licensed medical speech-language pathologist with years of experience, Pathways Speech Therapy was established to meet the needs of the growing communities in which it serves.
I'm Devin Chisholm, speech-language pathologist since 2009 and owner of Pathways Speech Therapy. We pride ourselves in being an ally in healthcare for patients and their loved ones. We do this by having the highest standards of evidence-based practice and therapy interventions, and by communicating closely with caregivers and other healthcare professionals. This is paramount to a patient's improvement and ongoing success. Treatment is focused on increasing functioning at home and in the community to promote successful return to work, ability to participate in activities of choice, and overall well-being. We have flexible therapy settings to meet the needs of each patient. So therapy is offered in my office, in your home, or through telehealth. Speech-language pathology is a unique component of healthcare. We have expertise in the areas of motor speech, language, voice, cognition, and swallowing function. Disorders impacting these functions generally result from neurological conditions related to acquired brain injury, such as tumor or stroke or seizures, neuromuscular conditions such as myasthenia gravis and muscular dystrophy, and neurodegenerative diseases like Alzheimer's, dementia, Parkinson's disease, and ALS. At Pathways Speech Therapy, we believe in following scientific research to apply the principles of motor learning and neuroplasticity when appropriate for optimal outcomes in treatment. In addition to neurological etiologies, certain disorders treated by SLPs can be linked to vocal misuse, intubation, respiratory issues, heart issues, tracheotomy, reflux, and cancer. Conditions are often intertwined with mental health, visual, and auditory impairments. I provide speech therapy to those dealing with complex issues and collaborate with other healthcare professionals. As hearing loss is associated with cognitive decline and communication impairment, I also offer hearing screenings as part of my service model.
Devin believes staying ahead of the curve by using the latest technologies. Let's learn about the latest diagnostic equipment that she uses for swallowing disorders.
Swallow function is a complex system involving motor and sensory nerve responses, muscle movements, air pressures, and coordination of breath. Yet, we swallow mostly without thinking about it until there's a problem. Problems can exist in the oral phase, pharyngeal phase, or esophageal phase of swallow. A fiber optic endoscopic evaluation of swallow is an instrumental diagnostic test that I perform. With this, I'm able to directly see what's happening internally when a person swallows food, liquid, or pills, and also allows for assessment of the soft tissues and for clinical signs of reflux. All very important in order to give recommendations and develop an appropriate plan of care for the patient. FEES uses a small, flexible, and fiber optic tube called an endoscope. It has a high-definition camera and light source attached to it. I pass the endoscope transnasally above the floor of the nasal passageway into your throat. It sits above your epiglottis for most of the viewing and gives direct view of a person's pharynx, larynx, esophageal opening, and top portion of the trachea. FEES is a very safe, accurate, and precise test that can identify if aspiration is present and what the source of the swallowing impairment is. I use the very latest state-of-the-art equipment, which is portable and lightweight, so I can perform my test in my office, at a patient's home, or at a doctor's office. I inform your doctor of the FEES results and work with you to develop a plan of care. This may include modifying foods or liquids, training and strategies for safer eating, and muscle strengthening. Pathways Speech Therapy also offers neuromuscular electrical stimulation, which retrains the brain's pathways for swallowing.
This process is helping me overcome the most frustrating and debilitating issue I've ever had to deal with, and that is memory loss. And I highly recommend Devin and her processes that she teaches to anyone needing help in that area.
Pathways Speech Therapy's philosophy is a blend of compassionate care with treatment that works. Whether it is a new problem or a chronic condition, they can help you find the right neural pathway forward.